Good morning, good afternoon, distinguished chair, colleagues and friends. I am Dr. Subhato Mukhopadhyay, Public Health Advisor of Humana People to People India or HPPI. HPPI is a national level NGO operational in multiple states of India where health is one of our major intervention areas. Today I would like to share our experience of integrating TB and HIV services through community platforms and why this approach is essential if we aim to reduce TB-related illness and deaths among people living with HIV. Although India has made remarkable progress in HIV care, significant gaps remain. India is home to an estimated 2.56 million people living with HIV, the second largest globally. About 1.69 million are receiving antiretroviral therapy, and most of them have also initiated TB preventive treatment. However, this still leaves an estimated 900,000 people living with HIV outside these essential services, making them much more vulnerable to tuberculosis. Every year, around 45,000 to 50,000 people living with HIV develop active TB. And TB continues to account for about 1/4 of all deaths among people living with HIV in India. These figures highlight an important reality. TB and HIV are closely linked diseases, but too often they are managed through separate programs. Patients experience both diseases together, so our health services must also work together. Service integration is therefore not just desirable, it is essential. With this vision, Humana People to People India integrated TB services into its existing HIV targeted intervention and link workers scheme projects in Delhi, Lucknow and Unnao in Uttar Pradesh and Kota in Telangana. Rather than creating a new program or recruiting additional staff, we strengthened the capacity of our existing HIV outreach teams. They were trained to conduct TB symptom screening, educate communities about TB and HIV in the same sessions, reduce stigma associated with both diseases, and establish strong referral linkages with the National Tuberculosis Elimination Program for diagnosis, treatment, and TB preventive treatment. This approach demonstrated that integration can be achieved through routine program activities using existing community platforms, making it both practical and highly cost effective. The results over the 5-year period from 2020 and 2025 were very encouraging. Among HIV high-risk population, more than 113,000 individuals were screened for TB symptoms. As a result, 671 people with TB were diagnosed, initiated on treatment, and all successfully completed treatment. In addition, 433 eligible household contacts completed TB preventive treatment, helping to prevent future TB disease. Within our people living with HIV cohort, we screened about 500 individuals, diagnosed 11 TB cases, initiated treatment for all, and 301 individuals received and completed TB preventive treatment. However, I believe the most important outcome is not simply the numbers. The most important lesson is that these results were achieved without establishing parallel system or requiring major additional resources. By strengthening the skills of existing frontline workers and integrating TB activities into routine HIV services, we were able to substantially improve access to TB screening, diagnosis, treatment, and prevention. The model also offers another important advantage. Community outreach workers already have the trust of vulnerable populations. When they provide integrated services, they reduce missed opportunities of early diagnosis and ensure that individuals receive more comprehensive care through a single trusted platform. As India moves towards the goals of ending TB and HIV, community-based service integration offers a practical way to strengthen both programs simultaneously. In conclusion, our experiences demonstrates The TB-HIV service integration is feasible, effective and scalable. It improves access to care, strengthens collaboration between programs, increases uptake of TB preventive treatment and ultimately saves life. I would like to end with one simple message. People do not experience TB and HIV separately, and therefore our health services should not be delivered separately. Integrating services around the needs of the people, not around diseases, is the key to achieving better health outcomes and accelerating progress towards ending both TB and HIV. Thank you very much.